probably nearing the end of your pregnancy and wondering, am I in labour? Well, today I'm going to walk you through the signs to look out for and how to know when it's time to head to hospital. I'm Brooke, I'm an obstetrics and gynecology doctor, and as well as working on the labour ward, I've got 3 children, and particularly in my last delivery, I know how difficult it can be to work out, is this actually it? I'm going to talk you through what might be happening as your body goes into labour and also what signs that you can ignore. So let's get into it. First, let's talk about the early signs of labour. So these can actually start days or even weeks before actual labour begins, so don't panic just yet. Here are a few things that you can watch out for. First up, lightening. So this is when the baby drops lower into the pelvis and it suddenly makes it easier for you to breathe. Someone might say to you, oh, it looks like your bump has dropped. And this also increases pelvic pressure. You might notice the baby pushing down more as you're walking around. Now, this is a helpful thing to feel, and you can say, oh, actually, maybe my body's getting ready, but it's really not a reliable sign, because especially if it's not your first baby, you may not notice your baby dropping down into the pelvis until right before delivery. Number 2, in increasing the amount of vaginal discharge. So you might notice that you're getting more and more white, watery vaginal discharge as you get to the end of your pregnancy. You might also see at some point a thick mucus-like discharge. Sometimes it can be tinged with blood, it might look like snot, and this is the show. Again, it's not that reliable, not everyone sees their show, but if you do see your show, it may be a sign that your cervix is starting to open, because that's the mucus plug and it sits in the entrance to the cervix as a barrier to prevent infection. But once the cervix starts to open, that plug can drop out. Seeing your show doesn't mean that you're in labour right now, but if you've seen your show and your contractions started, it might be a sign that things are happening. Next up, some mild cramps and back pain. So you might be getting some tightenings, you might have had them for a while, where your bump goes very hard. These can sometimes feel like period cramps, back pains. This is your body's way of getting ready. You'll notice an increase in your Braxton hicks, and it can make it much more difficult to sleep at this late point in pregnancy. None of these things are actual signs of labour, but they can be positive changes that something is starting to happen. Next, let's differentiate between true labour and false labour. It's really difficult because your body can give you some really convincing and confusing signs. First up, you may be starting to feel some contractions. So Braxton hicks, which are those practice contractions, they're usually irregular and painless. They can be triggered by activity. So when you go for a walk, you might be dehydrated or you even have a full bladder and you notice that your belly goes hard. Although we say they're painless, they can feel quite uncomfortable sometimes. However, true labour contractions, on the other hand, become regular. So you can notice that they're coming at the same time, for example, every 10 minutes. And you notice they start to get progressively stronger and closer together. They'll continue to happen even when you're resting or when you're trying to sleep. They usually start around your back and they move to your front, or they can happen in the other direction. Another important thing about true contractions is they tend to have a peak. So they start low, they increase in their intensity to the point when you feel the real squeezing and some discomfort or pain associated with it at the peak of the contraction, and then it eases off again. And the whole thing usually lasts around 45 to 90 seconds. If it's lasting longer than 90 seconds, actually that's more likely to be a Braxton hicks. They can last for several minutes. You might notice as they start to become more intense that you've got to breathe through them. You might have trouble talking or concentrating on something else. If you're not sure whether these are Braxton hicks or real contractions, try changing your activity, drink some water, maybe relax, just concentrate on see what's happening. If they continue to increase or intensify, yeah, you're probably in labour, you're starting to get into labour. If they disappear or they ease off again, it's not active labour just yet. Now, the big question. If you're planning a hospital birth, when should you go to the hospital? Well, here are some key guidelines. So in terms of the contractions, you can follow the 5-1-1 rule. I'd recommend that you call the hospital or your midwife when your contractions are around 5 minutes apart and that they're lasting for 1 minute each and they've been going for at least 1 hour. Particularly applies if it's your first baby. If you've had a baby before and things happened quickly, maybe don't wait for a full hour. When you're in active labour, your contractions should actually come every 2 to 3 minutes. So you can allow your contractions to get a bit closer together if you're still at home. But I recommend that you call the hospital, let them know that you're starting to have these contractions when they're coming every 5 minutes. We measure the time from the start of one contraction to the start of the next contraction. Next up, if your waters break. So if your water does break, note the time that it happens, the colour, and if there's any odour. Then call your healthcare provider. They'll likely tell you to come in so that they can check if it was your waters breaking. Even if your contractions haven't started yet, this is definitely a sign that labour is near. There are some other reasons that you might wish to go to hospital. If you have any heavy bleeding, so not just that blood-stained streaked discharge, you have some actual noticeable bleeding, go to the hospital immediately. If you experience any decrease in your baby's movement, contact your healthcare provider again right away. Sometimes you might just have a gut feeling. Trust your instincts. If you feel this is definitely labour or you feel that something is off, something's not right, just trust your instincts, go and get checked out. It is always better to be safe than sorry. Labour can absolutely be unpredictable. You might be having some start-stop contractions, but when they suddenly get going, things can happen quite quickly, even if it's your first baby. So for that reason, never be afraid to contact your midwife or your birth unit too frequently. It's fine to go in and be assessed and then be sent home again. It's annoying, but it's good to get the reassurance and to know where you are if you need to. It's always a good idea to call first so that they know that if you're coming in, and they can help you to decide if it's the right moment. And trust us, we can tell from your voice if it is time, if you are in active labour. Before we wrap up, here's a few final tips from me. So firstly, ensure you have your hospital bag packed and ready to go. Keep it in your car if you're going to be driving to the hospital. Ensure that your partner knows where everything is in that bag as well. Next up, keep your important phone numbers handy. So include your healthcare provider and a backup person, especially if you need some childcare. 3, plan your route to the hospital and think about a backup route just in case. Stay calm, focus on your breathing in and out. And if you feel that you're getting stressed, put some headphones on, try to focus on the things that are within your control, like your breathing, like your surroundings, what you're smelling, what you're seeing, what you can hear. Remember that every labour experience is unique, and don't hesitate to reach out to your doctor or your midwife if you've got any questions or concerns. So thanks for watching. I hope you found it helpful, and if you did, let me know if there's anything else that you wish you'd known about pregnancy, labour and birth.